how are you feeling? In terms of health, I'm speaking more so now. Everything okay? Do you have any issues or problems? Everything seems to be okay. Well, you seem to be adjusting to life aboard the spaceship very well indeed, I must say. But at this point, it is necessary to do a routine physical checkup on everybody. Okay, so I perform this same exact examination, you could call it, on every single person aboard the ship. Just standard procedure, really. First of all, before we do anything, I'm going to put on some latex gloves, just to keep things nice and hygienic, because there will probably be a few points in today's session together where I will need to touch you. Maybe your face, I think just your face today. Will that be okay for me to do? Yeah, excellent job. Obviously I'll explain everything as I do everything, so there'll be no surprises for you. It's a very standard and very easy examination for us today. Okay, there we go, nice and comfortable now. The very first thing that I need to do is I need to listen to your heart and then your lungs, okay? Using, of course, the stethoscope. Just gonna have a little check. Is this actually working? Very good, very good. Okay. Just want to warm it up a little bit. I'm just going to place this against your chest now, if I may. Yep, all okay. I'm just going to be listening to your heartbeat. Just for about 25 seconds, no longer than that is required. And I'm listening not just to the rate, the number of beats, but I'm also listening to the strength of your heart and the regularity, the rhythm. Okay. Sounds very good indeed. Very strong. Very good rhythm. Very good rate as well. Excellent job. Okay. So now I'm going to be listening to your lungs. Basically the same thing. I'm going to be placing this on the chest, various different locations. This will be location number 1. If I could ask you to take a deep breath in for me, please. Very good. And breathe out. Okay, excellent. Just moving the stethoscope to a different location now. Location number 2. And if we can do the same thing, please, a deep breath in for me. And breathe out. Okay, very good. I'm going to be moving the stethoscope to the third and final location for your lungs. Deep breath in for me. And out. Okay, that sounds good. That sounds very good indeed. Let's see what is next. So I'm just going to actually feel around your face now. If that's okay, I'm just going to press on different points on your face. I'm going to see if there is any reaction, any sort of involuntary twitching or anything of that nature. And I'm also going to be looking for whether or not you feel any pain or discomfort. Okay, so do let me know is now a cotton bud inside your mouth. I'm just going to try and touch the tonsils at the back there, okay? So it might be a little bit uncomfortable for just a moment, but nothing too bad. Going in now, touching tonsils now. Need to rub it for a couple of seconds, and then there we go. Okay, I've just taken that sample, and I'm going to put that in a nice safe container. Okay, and we're going to send that off for some checks in the laboratory, just to make sure that your health is tipped up as we want it to be. Okay, so I have a little bit of a fun few tests for you now. I have some flavors for you to identify for me. Okay, so I'm just going to shake up my little bottle of artificial flavor here, and then I'm going to place 3 different flavors on your tongue. I want you to tell me what each of the flavors is. Okay. Okie dokie. If you could stick your tongue out for me. Very good. Let's pop a little droplet on your tongue there. And what does that taste like? Tastes like mango. Very good indeed. Okie dokie. We move on now to our second flavor to identify. Okay, here we go. Flavor number 2 for you to identify. So if you could just stick your tongue out for me once again. Pop a little droplet of the flavor on there for you. Very good. And what does that taste like? Tastes like papaya. Excellent job. Okie dokie. Now we're moving on to the third and final flavor of the day for you to identify for me. Okay. Just make sure that's nicely mixed. Okay, you know the drill by now. Tongue out for me. Very good. Put a little droplet on there. And what does our final flavor taste like? Coconut. Very good. Okay, you have correctly identified all 3 flavors. And now I have a very similar test for you. Identifying smells. Okay, so just as we had 3 flavors, I now have 3 artificial smells for you to identify. Okay, so here we go. If you could sniff that for me, please. Take a good sniff, sniff, sniff. A good sniff, sniff, sniff. And what do you think that scent is? Grass. Smells like grass indeed. Very good. Okie dokie. Let us move on to scent number 2. Okay. Here we go. If you could take a sniff of this one. A sniff, sniff, sniff. A sniff, sniff, sniff. Very good. And what does that one smell like? Lavender. Excellent. Well done. Moving on to our final scent of the day. Third and final one. Okay. Oh, my scalp is stuck there. There we go. If you could take a sniff of that one, please. A good sniff. What does that smell like to you? It smells like lemon. Very good. Well done. 3 of 3 scents correctly identified. Okay, now I just need to take a quick look inside your ears using the otoscope. Putting on a fresh nib for you so we're nice and hygienic, of course. Just going to place this in your ear canal ever so slightly. Very shallow, it's not uncomfortable, is it? Oh, that's good. Okay, I'm just going to be looking now. Very good. Very happy with what I'm seeing there. We did clean your ears out not too long ago, if I remember correctly. Gonna have a look in this ear now as well. things first, I'm going to take a group of measurements of your face, okay? I'll do a bunch in one go. Just try and remember them and then I'll write them down. Otherwise, if I write down each one individually, we'll be here all day, which I'm sure neither of us want. You have plenty of things you could be doing aboard the spaceship, a few duties to carry out, and then of course some leisure time. What kind of things are you doing in your leisure time aboard the spaceship? If you don't mind me asking, that's just a question for curiosity. Really, that's a cool hobby actually. That's an interesting one. Something I didn't even really think about doing. Something I didn't consider might be a possibility aboard the spaceship. Where do you do that? Very cool. And you do that with other people, or is that more of like a solo activity? Okay, that is very cool. I might try that out myself in my own leisure time. I haven't had a great deal of leisure time yet, unfortunately. We do have multiple members of medical staff aboard the ship, but we're all very busy. Obviously the crew, the total number of crew is 670 something, I think. It's in the high 600s, and we need to do these regular routine tests, medical tests of every single person aboard the ship. So obviously, as you can imagine, that keeps us very busy indeed. And we do have a few side experiments going on, just to try and further our knowledge of how people, biological things, behave in space and aboard a spaceship. Obviously the environment and the living situation is very, very different here than it is back on Earth, so there's a lot of factors to consider. Okay, I think this is the final measurement for your face. I'm just going to quickly write those down before I forget them all. Okay. Very quickly a few areas of your body. Okay, so I'm going to be measuring your upper arm, your bicep, so to speak. So if you could hold your arm up for me. Very good. I'm just going to wrap this around. Okay, let's have a quick look at that. Very good. And if you could hold out your other arm for me, please. Going to be doing the exact same thing on that one. Measuring the guns. Okay, let's have a look there. Very impressive biceps you have them. Bigger than mine. I need to work out. Okay, so now I'm just going to measure your chest circumference, your torso. Okay, so I'm just going to wrap this around you. Okay, just taking a... I want to be accurate. Okay, very good. I'm going to slip this down to your waist now. Put that down here. Do the waist measurement. Okay, very good. I think we'll do individual thighs, and then calf measurements only, okay? So if you want to pop your leg up on the chair there for me, step up on it, so to speak. Very good. Just take a quick measurement there. That's great. And then I'll do the other one. Very good. Okay, measure that. Excellent. I'll just do the calves now, okay? So let's take a look down here. Okay. Very good. That's the one calf done. And now I'll do the other one, okay? There we go. And of course, I just want to write down those measurements. Okay, very good. Now we're going to move on to our survey. 10 simple questions for you. Question number 1. How healthy do you consider yourself on a scale of 1 to 10? 1 of course being very unhealthy, 10 being perfect health. Very good. Our next question. Do you have any chronic diseases or illnesses? Anything like that? Okay. Our next question. Are there any hereditary diseases that run through your family? That is relevant, yeah. Any information you can give me regarding medical. It's 3. Okay, on to our next question. Do you have any drug or alcohol habits? Anything I should know about that? Any substance abuse? Okay. How regularly is that? Okay, no problem. Okay, now a few questions pertaining to your mental health more than anything else. Over the past 2 weeks, how often have you felt nervous, anxious, or on edge? The past 2 weeks, how often would you say? Okay. And over the past 2 weeks, how often have you felt down, depressed, or hopeless? So any teeth removed? Okay. Okay, very good. Next question. How often do you have trouble taking the medication that you are prescribed? So would you say it's difficulty actually swallowing tablets? Oh, okay. So not forgetfulness or anything like that? Okay. Okay, and our final question. How many of the last 7 days have you done exercise? And what sort of exercise have you done in the last 7 days? Okay, that's actually the entire survey done. Quite a short one. As I mentioned, I gotta ask those questions to every single